What we have learned in cardiovascular medicine is that patients that are exposed to adverse comorbidities, for example diabetes or high blood pressure, and also potentially receipt of certain drugs to treat cancer can injure the heart muscle. Newly, we've learned over the last 5 to 10 years, when the heart muscle is injured, another process that starts to occur is the development of fibrosis. It's kind of like if you have a cut on your skin. You'll see a scar form sometimes. Well, that's fibrosis. Well, inside the heart, we can also develop fibrosis. And the bad thing about fibrosis is it's very difficult to reverse. It's almost like pouring concrete around the structure of the heart. The heart becomes rigid and stiff. It doesn't contract well, and it doesn't relax well. So we had noticed, why did we go and perform this particular study? Investigators have shown that patients that happened to be treated for cancer and survived 7 to 8 years later, they had more fibrosis in the heart. But what we didn't know is, was that fibrosis due to not the chemotherapy drugs, but just the fact that they had cancer? Was it also due to other comorbidities, high blood pressure or diabetes that they may have had in addition to the treatment for cancer? What this study did is it looked at patients with cancer but hadn't been treated yet, looked at patients with the comorbidities, and then diabetes and hypertension, and also looked at patients that had been treated for cancer with anthracyclines. And what the results showed is there was an increase in the amount of fibrosis that was related to the receipt of the cancer drugs, as opposed to patients with the coexisting cardiovascular comorbidities or that just had cancer alone and had yet to be treated. These assessments are obtained T1 and ECV with magnetic resonance imaging. So those are the round scanners where you go up inside of the tube, and we use radio waves and magnetic fields to make the images. There's no ionizing radiation like X-rays. And what we do is we take some properties of the magnetic resonance imaging, the T1 value, that we extract, and it gives us insight into why or how heart muscle or other tissue around that heart muscle is developing or becoming injured. What we do with ECV is we obtain a T1 value without any contrast on board, and then we obtain a value with gadolinium contrast. It's injected through the veins, and we put those two together to get the ECV. So the ECV reflects, it stands for extracellular volume. It looks at the material outside of the heart muscle cells. And what this study is indicating in a cross-sectional analysis is that patients that were receiving drugs to treat cancer, chemotherapeutic drugs, as they had an increase in the development of ECV, or the fibrosis that surrounds the heart muscle cells, about 3 years after they'd received the chemotherapy. So the take-home message for this research is the following. To date, we have focused on studying the impact of heart muscle injury after receiving treatment for cancer. And when we do that, we look at the contraction or the relaxation of the heart muscle, and we look at heart pumping function. What we haven't done is looked at other processes. And what we find in other cardiovascular diseases is that fibrosis can occur within the heart. As we age, we develop a little bit more fibrosis. What these results are showing is that when patients receive a particular type of chemotherapeutic drug, that they also later develop fibrosis. And that fibrosis inside the heart in other disease processes is associated with adverse cardiovascular events. Heart attacks, heart failure, and things of that nature. The implication of the results is that we need to now be looking for the fibrosis and try to prevent that. Because once fibrosis occurs, we really can't get rid of it. And we have to administer therapeutic interventions, medications, exercise regimens to try and ameliorate or minimize the impact of that fibrosis. What's happened over the last 20 to 30 years in the field of management of cancer is there have been great progress. So much so that patients are living much longer as a result of their treatment for cancer. Cancer is being cured more frequently and it's being put into remission. The medications and the other therapies, radiation and whatnot, that are used to treat the cancer can also have other side effects. Some of those are related to injury to the heart and the vascular in our vascular systems. And so today, as patients are going in to be treated for cancer, it looks like we need to also start thinking about where there'll be potential side effects on the heart. We don't want to get into a situation where we trade treatment for one disease process, cancer, for in order to promote or cause another disease process, cardiovascular disease, heart attacks, strokes, and heart failure. And so I think what we'll see over the next 5 to 10 years is a lot of investigative research in trying to prevent cardiovascular events in these patients as they're successfully treated for their cancer.